Simvastatin is used together with a proper diet to treat high cholesterol and triglyceride levels in the blood. This medicine may help prevent medical problems, e.g. heart or blood vessel problems, heart attacks or strokes caused by clogged blood vessels. Simvastatin may also be used to prevent certain types of heart problems in patients with risk factors for heart problems. Proper use. Take this medicine only as directed by a doctor. Do not use more of it, do not use it more often, and do not use it for a longer time than the doctor ordered. If you are using the oral suspension, take this medicine on the evening on an empty stomach. Shake the oral suspension well for at least 20 seconds before using it. Use a marked measuring spoon, oral syringe, or medicine cup to measure the right dose. In addition to this medicine, your doctor might change your diet to one that is low in fat, sugar, and cholesterol. Carefully follow your doctor's orders about any special diet. Tell your doctor if you are regularly drinking grapefruit juice. Drinking large amounts of grapefruit juice, more than 1 quart each day, while taking this medicine may increase your risk of muscle injury and could result in kidney problems. Do not drink large amounts of alcohol with simvastatin. This could cause unwanted effects on the liver. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For all dosage forms, suspension or tablets, for high cholesterol, adults 20 to 40 mg once a day in the evening. Your doctor may adjust your dose as needed. Children 10 years of age and older, 10 to 40 mg once a day in the evening. Your doctor may increase your dose as needed. Children younger than 10 years of age, use and dose must be determined by a doctor. Contraindications. Hypersensitivity to simvastatin or to other components of the drug. Liver diseases in the active phase, a persistent increase in the activity of liver enzymes of unclear etiology. Diseases of the skeletal muscles, myopathy. Age up to 18 years, efficacy and safety not established. Precautions. It is very important that your doctor check your progress at regular visits. This will allow your doctor to see if the medicine is working properly and to decide if you should continue to take it. Blood and urine tests may be needed to check for unwanted effects. Using this medicine while you are pregnant can harm your unborn baby. Use an effective form of birth control to keep from getting pregnant. If you think you have become pregnant while using the medicine, tell your doctor right away. Do not take other medicines unless they have been discussed with your doctor. This includes prescription or non-prescription medicines and herbal or vitamin supplements. What side effects can this medication cause? Simvastatin may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Constipation, stomach pain, nausea, headache, memory loss or forgetfulness, confusion, itchy or red skin. Some side effects can be serious. If you experience any of the following symptoms, call a doctor immediately or get emergency medical help: muscle pain, tenderness, or weakness with or without fever or lack of energy, dark red urine, decreased urination, lack of energy, tiredness or weakness, loss of appetite, pain in the upper right part of the stomach, yellowing of the skin or eyes, dark colored urine, fever or chills, flushing, blisters, rash, hives, itching, swelling of your face, throat, tongue, lips, eyes, hands, feet, ankles or lower legs, difficulty breathing or swallowing, hoarseness, joint pain, sensitivity to light,